Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amy.
And my name is Sarah.
And we are your podcast hosts. So just remember, we have our Gritty Nurse apparel line. You can find us at www.grittynurse.com. Please join the conversation, make a statement, and go to our website.
And if you're listening on Apple Podcasts, Spotify, Amazon Music, or any other podcast listening platform, be sure to hit subscribe so you can get updates to when we release episodes. Also, be sure to rate and review us. You can also find us on Patreon. We are at Patreon at the Gritty Nurse Podcast. We just wanted to let you know that any donation you make, however big or small, is going towards supporting our monthly podcast costs, which include podcast hosting, our website, audio equipment that we use, and also the time and energy it takes us to research and put out good quality episodes for you guys.
All right. So today we're going to be talking about we actually got a request. So this is actually going to be an interesting episode. Of course, very lighthearted because, as much as we are gritty nurses and we talk about a lot of other issues, sometimes we need to do something lighthearted and fun. And this is our lighthearted and fun episode. So Sarah, take it away. What are we talking about today?
We are going to be talking about grossest stories at work. Okay. And just a disclaimer before we even start that you may want to listen to this while you're not eating, because even for us nurses, I think this is like the threshold of grossest of the gross. And the reason that we wanted to do this episode is to really pay respect to everything that we as nurses do. And, for someone that's thinking about going into nursing, we don't want this to scare you off. We more want to tell you these stories as entertaining little tidbits and finish off with some takeaways.
Yeah, and definitely this is not to minimize our patients that are experiencing these things. Definitely not. It's more just to talk about like some of the things that we've seen, and then we'll probably get into some takeaways in terms of, why might we be seeing some of these really horrifying things in our patients. But maybe Sarah, you can probably take it away with talking about one of our first stories. Do you want to clump them up? Oh my god!
No pun intended. No pun intended.
But like, do you want to kind of like how you have them set up? Do you want to kind of like go through them that way?
Yeah. So I think the first category we're going to get into is poop, and more poop. Let's just talk about that, because this is obviously a daily thing that we deal with as nurses. Me as an obstetrical nurse, so mostly I dealt with baby poop, which I was very fortunate to do because I think, they're small and they're cute. There's not a lot of poop. And especially when babies are first born, the poo doesn't smell. So I am just telling these stories because I think that I really respect any nurse that has had to do any of these things. So the first story is about a patient that had a bowel obstruction. So just as her family walked through the door for a visit, the patient began to projectile vomit and spew feces from every orifice in her body, some of it landing on family members. The nurse's aide and I both grabbed bedpans, trying to catch the spew at the same time, closed the door, and politely asked the family to please come back later.
Oh God!
I'm imagining this is like a scene out of a horror movie. Like, can you imagine just out of every orifice, and the added fact of like bad timing with the family walking in at the same time?
Yeah, and I mean, I think I could only imagine how horrifying it is for the patient too, right? Like they're cognizant, they know that they're there for an issue with their bowels, and now their bowels are not coming out from their rectum or anus. It is now spewing from their mouth. So I could only imagine how absolutely horrifying that'd be for them as well. And again, just airing your sediment as like a labor and delivery nurse, we see poop all the time. It's like a natural thing. I mean,
but we don't see this level of poop. I mean, we see women pooping right before they go into labor or as they're going into labor, but it's not to this degree for sure. And even in this case, right, I'm not sure if everybody is aware, especially if you don't deal with bowel obstructions, that when it becomes really bad, that's when your body tries to eject it out of any orifice they can, which means it can come out of the mouth. Like, can you imagine what the patient must be feeling like?
No, I think it would be the worst. I was going to say this would be the worst thing, but I've read some other really horrifying things, but I think it'd be unimaginable, right? Like, I don't think I could even put myself in that patient's shoes to be like, I am vomiting feces. Like, I think that would be just, yeah, nope. I can't. It's just like horrifying. But yeah, like I was saying, like, in labor and delivery, yes, the patients are pooing. And the thing is, we have to also realize that poo is not like this abnormal, nasty thing. Yeah, well, yes, it is gross. But the thing is, everybody does it, right? Like, everybody takes a poo. Like, don't even the prettiest bikini models, they all take a poo. So, like, let's normalize the fact that poo happens. Unfortunately, it happened to this patient, family, and the nurse. And let's move on with the day. Change your scrubs, have a shower. Next patient.
Oh gosh.
All right. Let's talk about our wounds, and wounds galore. So we actually got a couple really good stories here, but I'm going to read one here that we got from someone who talked about an elderly woman who was brought in by her adult children for a foul smell. She also had general weakness and a low grade temp. So the nurse started to do the assessment and could smell this like god awful stench and was kind of like, where the hell is this coming from? So the nurse tried to get the patient to change into a gown so she could look for any wounds or anything like that as such. So she finally agreed to let her kids help change her. She was really adamant about not removing her hat, though. She did not want to take off the hat. So she didn't want to take off the hat. So she had a long talk with her before they knew that this was the actual problem. And she was being so aggressive when she talked about removing the cap. It was a no, like, this is not going to happen. But finally, they were actually able to remove it. The nurse had asked the patient if she had a wig on because I guess her hair looked really matted and not really, really well kept or groomed. And the patient was like, yes, but you're not touching it. And again, the nurse was like, okay, you really need to let me take a look at this. Like, I need to see what's happening. And then they were able to remove it. So the nurse says, I almost gagged and almost passed out. Nothing really gets me except for mucus and traits, but this almost got me. When we peeled the wig back, there was a quarter of her hair, skin, and scalp gone, but covered in maggots. So the smell was so strong enough it would probably kill a horse. She was
Oh
so
god.
horrified, not just because of the maggots, but because this poor woman didn't know what to do, and her children were so embarrassed and ashamed. So the nurse, of course, being a nurse, spent some extra time with the family talking about how to deal with it psychologically, as well as what the next steps would be in terms of this discovery. So I mean, what I could tell you, maggots for me are like a no go. I remember.
There's your line right there, Amy. It's like, no
No, no
maggots, not
maggots. I
dealing with
think I
this
could take
ever.
almost anything, like blood, guts, like gushing, whatever. I could take all pus, whatever, all those types of things. But I think maggots for me are where I would draw the line. I'm probably sure I would pass out. Like, I would just like hit the ground. That'd be it. Put me in an ambulance or take me down to the ED because I'd be done. Because I just don't know. Like, I look at them and I can't handle them. Like, if I see one maggot by my garbage, I'm like, Jordan, that's your job. Nope, I'm done. I can't do this. But I mean, I can only imagine the fact that this person was living with this, right? She knew what was under there and was too embarrassed and too ashamed to tell her family. So, I mean, there must have been a lot of other things going on. So Sarah, like, do you think there probably was some things?
I think it's more about yourself as a parent, right? Because I imagine myself with my kids and how I am, right? At some point, I'm thinking I am gonna get older, like, let's say in 40 years from now, and they're gonna be looking after me, and I think the dynamic when that switches is really hard for people. So, I mean, she probably knew what was happening, but she didn't want to lose their respect of how they saw her as a mother, right? And at the same time, the kids are probably thinking, I need to get my mom help, and I know that something is very wrong, but she won't let me see what it is. I think it's maybe just that pride that you have being strong in front of your kids that she just didn't want to show any weakness or, show that she wasn't doing well.
Yeah, but I mean, there's got to be
Yeah.
something else there, right? Like, I feel like maybe there's a component of mental health that she felt that maybe there's other things going on, because I just feel like if you are in your right mind and you know that this is happening to you, how could you just leave it? Like, it can't be just like, I'm so ashamed. I don't want anybody to know that I have maggots under my wig.
Well, maybe she didn't know, like, honestly, maybe she probably didn't take that wig off for months, and
Right.
she was in denial about what was happening,
Oh
so
dear.
we don't really know, but it's probably more common than we realize
Yeah.
because, it's just being in denial and not wanting to face the truth. So, let's see here. Just moving on to other stories, we've got some about secretions from the mouth and nose. So, I have one here. This nurse ran to the ICU when a code was called. The doctor was intubating, and she was standing right next to him, next to the patient's head. He went in the esophagus right when the person was doing compressions pushed down. Stomach contents came spewing out of the ET tube and right into her face.
So I feel like this is a common occurrence because I've actually, within my own practice, even when I was a nursing student, saw this many times, whether it was coffee grounds, just general stomach contents. I used to see that all the time. And because the patient has an ETT tube in, it just goes everywhere. So it's just like, yikes. But I mean,
You know what? Actually, this actually just reminded me of another story related to labor and delivery, though. So, my very, very first delivery that I ever saw as a student, I remember standing near the foot of the bed and the patient's pushing, right? And then I actually didn't know what the smell of amniotic fluid was like before this. And I was like, it's hard to describe. It's kind of like this eggy, sort like kind of like, I don't know, eggy smell. That's how I describe it.
right.
And then I remember her pushing. And then this like huge puddle, I guess you could say, of amniotic fluid just went spraying like all directions, like side, front, like everywhere. And then I remember having to jump back so that it wouldn't land on my shoes. And my preceptor was like, "Okay, make sure you put a towel on that. You don't want to slip." She's like, "I don't want to talk about like how many times that's happened."
Oh no.
So secretions out of that area are very common too. And so that's why you always want to wear your PPE for any situation you're going into. Obviously, if it's an emergency code, like I guess you might not be able to get everything on, but you really should. I
No,
just
that's a full on like pause and stop moment for me where I'm
well, especially in this climate, I think any code that you run to, you should already have like most of your PPE on,
yeah, like
if not
I'm
all of it.
pretty certain from like just being on various different committees, the whole idea is like if you're going to do compressions or you're going to open up the airway that you need adequate PPE. So, I mean, if someone has started compressions, then you should really before you come into the room having your PPE on and then bringing your like letting the other person switch off so they can get the adequate PPE on as well. So, and I know definitely
Right.
like you said with COVID times everyone's gowned up well before and they just have to kind of that's just the way it is. That's the way the climate has changed. But
Yeah, and I think at least in this situation, you know that the compressions were effective
yeah,
because
very
you're
effective.
applying enough pressure that other contents are coming out of other orifices.
Yeah, and I mean, like, just kind of going back to what you were saying about the amniotic fluid, I've been splashed many a times. So this is why I stopped wearing runners in labor and delivery because I just couldn't afford to keep swapping them out. So yes, I had those like ugly cloggy shoes, but they rinsed out very well. And I always, let me just tell you, always have an extra pair of socks and underwear and an extra bra because
Yes, yes,
the
definitely.
fluids go everywhere. And then you know what? There's nothing like walking around with an amniotic fluid splash bra or no bra at all in those like skin, you know, the like blues, the blues or green scrubs. Oh my god, you could see.
Oh my gosh, Amy. Exactly. I know what you're saying. What you said about the shoes is so true, and a lot of hospitals are really strict, especially with occupational health, about what type of shoes you have to wear. And I remember nurses, you know, really complaining about, "Oh, it can't be mesh, it can't be this, it can't be that." Well, this is why, because in most clinical areas, you are at high risk of getting splashed with some sort of bodily fluid, and it's for your own protection that you don't have shoes with, you know, those Crocs with the holes in them, or like mesh where it's not going to protect you at all, or like say you work in the OR and you drop an instrument, right? You don't know if it's going to be sharp or not. So it's really just for your protection. And it's not maybe the sexiest or stylish type of shoe, but it's really the best thing that you should be wearing.
Well, I think some of these companies have actually come a long way because I remember the ones that I had, they were like purple. They had all sorts of cool designs and butterflies on them. I was like, oh, these are kind of cute. They weren't like beautiful, but I mean, I think some companies are kind of like, yeah, we need to like not make this the ugliest thing ever. But
Need to
you
step it
want
up.
really what you want is comfort, function, and functionality, and a little bit of style, but you don't need a lot. So, but yeah.
Mhm.
Oh my goodness. So let's get into our what Sarah would call them crotch goblins. I love that name. When I saw it, I was just like, crotch goblins? This is amazing. So there's actually a couple stories. So I'll probably jump into one, and maybe Sarah, you want to do another one. But I have to be honest, this one was the one that was the worst for me. So it's right here at the top, and it was this patient who essentially was an elderly man who came in with an infected penile implant. So let me just go to say, right? Like, I mean, I know people do these things, right? But it's just like, now you've gone to great lengths, haha. So you've actually tried to,
No pun
I
intended.
know, I'm really actually not trying to be punny, but like, you've gone to this extent to extend your manhood, and now it's infected, right? So I really hope that people understand what it is when you have an infection. And maybe we'll kind of get into this, but essentially this elderly man came in with his infected penile implant. And the doctor and a couple of the nurses started examining it. And of course, he had it covered up, right? Because you're just like, you come in and you're like, oh, I got this problem. And you're like, okay, well, let's see it. When they went to look, they realized that his penis had actually split in 3 different parts. So 3 full different ways. And pus was.
Amy, I'm just having this mental image of a banana, like
No, no,
a banana
no,
peel. I
no.
don't know why.
Oh, that's horrifying. So essentially, penis split 3 different ways, pus everywhere, and his wife said she didn't even know why he got the damn thing anyways because he sure didn't use it on her. Oh my god, freaking mic drop right there. I was just like, oh no, like that's a whole other problem in itself. But like, ouch, right? And I mean, I could only imagine how horrifying that would be. Like, I think men see themselves, I shouldn't say this, but like, their privates are important to them, right? They take pride in their junk, right? And I think when their stuff gets messed up, it's like a huge issue. But I can only imagine, like, how did it get to the fact that it was that bad? Like, you would have known when you like started pumping up your penile implant or whatever that like things were wrong. Like, there would have been redness at first. There maybe would have been pain. Maybe there would have been a foul smell or secretions coming out of it. But like, the fact that it was no longer like unified as one assembly piece, it was 3,
Oh
like,
god.
yikes. Oh no.
Oh my god.
So yikes.
Okay, I've got another story about man junk. So this nurse submitted a story that she works in a jail and had a guy with a herpes breakout.
No.
His scrotum was the size of 2 grapefruits, and he had sores oozing. He also had open sores in his mouth. And the hospital nurse said she had never seen anything this bad in her 30 years of nursing. When he came back, we had to clean and do a swab on his sores. The smell could have knocked you over. The kicker is that he was the biggest a-hole in the world. Plus, he was screaming because he didn't want us to tell the Board of Health where his girlfriend worked. Yep, the girlfriend he cheated on and then got herpes. His mouth had gotten so bad that he couldn't eat and was drooling on himself. It was the best example of karma I ever did see.
God.
Stuff that you don't learn about in nursing school or clinicals. I mean, like, you can't make this stuff up. This
No.
is just like, no. I mean, I don't even know what that actually would look like, but it looks comical to me in my mind. So now we just had a story about like a banana penis and now grapefruit balls and
Oh no. Like, I mean, I think I really wonder how these things get this bad, right? Like, it just begs to question, like, what is happening that someone waits so long to receive care. But I think we'll kind of unpack that a little bit at the end. So let's talk about losing body parts. Oh dear. So there was an elderly lady with a necrotic foot and toe. So we've all seen this before with our diabetic patients, right? So this one particular patient, the nurse had changed her dressing and actually found a toe in the dressing one morning. The same lady had maggots crawl out from her vagina, and that's just crazy in itself. So they had sent her to the ICU where she was confirmed that she was basically rotting from the inside out. So that's really actually kind of sad.
I know, it's kinda sad. It's kinda sad and gross at the same time. Like, I think for her, if she was in that poor health, she must not have been cognitively aware, probably didn't have any supports, didn't know what was happening, and there was no really, person to advocate for her health.
Yeah. Oh dear.
Okay. Alright, let's talk about random things up the butt. This is
Yes.
always kind of entertaining, especially for you emerge nurses. I would love to hear about other stories about things that, people put up their butts. But we're gonna talk about this one case. Actually, it took place in the OR. There was a random guy that came in with a glass hot sauce bottle stuck up his butt.
Hot sauce.
Hot sauce, like, I don't know what brand, like
Brand?
sriracha or something. Who knows?
Sriracha.
It was so difficult to remove. They actually had to put him to sleep, and they tried forever to remove it with their hands. So when they finally did what felt like someone's whole arm was up the patient's rectum, they got it out. It was actually an unopened glass bottle of Texas Pete hot sauce. And then this nurse says, "I always wondered if it hadn't gotten stuck, would he have used it? Like, would he have actually put it in some food that he was."
Let's spice up my French fries today. Good.
So then the protocol here is to double bag specimens, quote unquote specimens. And so they first put it into a regular Ziploc bag, and then when she went to go put it into the second bag, which was a biohazard bag, the Ziploc bag dropped.
Oh no.
So it fell onto the floor and shattered, and there was glass everywhere. The look on the nurse's face and everybody else's faces was priceless.
Oh no. Well, I mean, could you imagine if it shattered or opened in his rectum or his anus? Like, could you imagine the I think he would probably die actually. Like because in hot sauce there's it's called capsaicin,
Oh
right?
gosh, Amy. Oh my god, Amy, I'm thinking of, like, internal bleeding, but also the pain, like, the burning
That's
sensation
what I'm
of
talking about. I'm not even talking about the fact of the glass shards. Sarah, I can't. Like, I mean, I'm not even talking about the glass shards. Like, that wouldn't be the concern for me. It'd be the fact that he has, like, super, super hot sauce. So I can't even talk. Oh my god, like that I think that would actually kill him. And you know what? Let's just call a spade. He didn't put that bottle up there because he was trying to get something out. That was for sexual pleasure, okay?
Don't you love how people come up with excuses like, "Oh, I just fell on it," right? Like, no, you didn't just fall on it. Or if you wanted something up your butt, why would you not empty the bottle first of its contents? Like, come on.
Sarah, I mean, okay, there's like a variety. So sorry, but there's like a variety of different things that, like, I think we've heard of people putting in their butts, like weights. Like, I just don't understand. It's just like, okay, come on, take that money, whatever money that you spend on Starbucks, and just go get yourself a proper butt plug or whatever the case may be, right? Get
Or anal
something that can
beads.
slide in easily and slide back out. Like, why are people like? I've even read about people using like 2-liter bottles of Coke. Like, what the?
No way. Okay. I think we're talking about the embarrassment level here. Okay, so maybe he was too embarrassed to order something online, but ordering something online and having someone see it versus going to the hospital and maybe 10 to 15 people trying to get this out of your butt.
Yeah,
What would you prefer?
I think this happens more frequently and more commonly than we would like to know or actually expect to see. And I think, I mean, I am not knocking anybody for their sexual preferences. Whatever. You want to put something up your butt, by all means. But
You do
please
you.
find something that won't get stuck or kill you. Like, seriously. Yes. Okay. So let me throw one more out there, and then we should probably talk about a little bit, maybe about why we might be seeing some of these things here.
Okay, so here we're going to talk about this nurse's first nursing job. So she walked into a patient's room, and this patient had blood all over her mouth. So just imagine dripping blood out like a vampire,
Oh my
and
god.
the nurse is freaking out, trying to figure out what is happening. Is she bleeding from her mouth? Is she bleeding from internally? And what's happening? So she looked at her IV and noticed that it was disconnected and oozing blood. She said to the patient, "What are you doing? What's going on?" And the patient said she started sucking the blood out of her IV. And when questioned why, she said, "Well, you guys don't feed me, so I have to drink my own blood for food."
Oh my god. Oh no. That's so sad.
That's crazy and sad at the same
Oh my
time.
god.
And I'm thinking from the nurse's perspective, what if she was a hard poke and now you're like, "Oh, I've lost my access. What am I going to do?"
Oh no. It sounds like that patient definitely had maybe some other things happening going on there. Like it can't just be like she was hungry. Like I don't know, you know what I mean?
Mhm, mhm.
But let's talk about some of the takeaways. So, yeah, like I mean, we told a lot of stories. Some of them were horrifying, some of them are really funny. But let's talk about the patient and all this, right? Like I think the one of the most important things for me in terms of a takeaway is try to put yourself in the other person's shoes, right? So if they have dementia, if they're from a lower socioeconomic status background or whatever the case may be, like I think we have to put all of these things into perspective. So yes, they're gross, they're horrifying, but these things don't happen just in isolation amongst themselves. So I think people, I guess if you're learning or you're new to nursing, or even if you just need a quick refresher, we have to remember that there's something called the social determinants of health, right? So there are various different things that kind of impact the way people are cared for, and actually these different social determinants can actually affect their health. And I think a lot of the stories and the cases that we got were from our American partners, right? Like, I mean, I think most of the people that we that work with us and that discuss with us are actually American. So I think that also plays a huge role into it, whether they have the adequate healthcare to seek out to getting help before the problem is bigger than it, to seek out adequate healthcare before the problem gets as big as it is.
Yeah, and I think that also we have to remember that people are all human, right? So no matter how gross the situation is, we still need to treat them with respect. And I think, yes, we're telling this story on a podcast, but if you're actually at work, you want to be really cognizant of where you're telling this story and who you're telling it to. It should really just be people that need to know on a need to know basis. This is what happened. So we shouldn't be talking about this kind of thing in an elevator or the hospital cafeteria or out in the hallway, because it's really just protecting that patient's dignity and their privacy.
And really, the reason why I think people tell these stories is because it probably impacted them in some way. Like, there's no way you can kind of walk away from seeing some of the things that we've seen or doing some of the things that we've had to do without having, whether it's a comical spin on it to kind of, make it a little bit more lighthearted for you, versus, the opposite effect, which would be being very depressed and whatever. So I think telling these stories are also a form of a coping mechanism, right? Like I think healthcare
For
providers
sure.
see so many horrible things. Like they see a lot of great things and a lot of good things, but they do see a lot of really horrible and heavy things. And I think sometimes just by telling the story and making it a little bit lighthearted is very cathartic for people. And I want people to understand that this is definitely not at all to minimize a patient's experience, because obviously we know that they play a huge part in terms of what's happening, and we understand and we empathize with the fact that these patients and these families are going through these things. But just from the other end and the other lens, why nurses might want to talk about these things with their peers, or even talking to us about them, is really to help with that cathartic healing and talking about these experiences, because they at some level they are quite traumatizing.
Yeah, I totally agree. And I think just some other practical tips that Amy and I have touched on is make sure that you have a full change of clothes for every shift that you're on, right? So socks, underwear, bra, scrub top, have all of that ready. And a trick that I used to do is if I knew I was walking into a room that had a really bad smell, I guess now with the pandemic, it's a bit different, but just even like putting something right under your nose that smells really nice, like maybe some hand lotion or like something that smells nice to sort of mask the odor that you might be walking into. However, now with all of the PPE that you're wearing, that might have changed, but just something to keep in mind. And like sometimes you can't do it with it and you might need to step out of the room for a minute, and that's okay too. Just talk to someone on your unit and let them know how you're doing. If you need a little bit of extra support, see if someone is able to assist you with a procedure or has some advice for you on how to get through it.
Yeah, and I feel like nurses are very helpful. Like for the most part, we're I shouldn't say for the most part, but we are a team, right? And I think that there's never a situation you have to go in and that you're alone. It seems like all of these stories and all of the instances that we've even had, we had help and support from our other colleagues. So I think again, make sure that you're having that support. And then I think the other part that we continue to forget is to debrief. Like, holy crap, these stories all
Literally,
need,
holy crap.
holy crap, these stories need a debrief. I think it's okay to say, as opposed to doing gossiping, because we know that is not what we want. And we know that there's a circle of care in terms of who you should be able to talk about your patient to, only people that are really involved in the care. But some of these things are so traumatic that they do require a debrief. And I think a lot of people wait for management to do it, and you don't have to. So
Mhm.
take that upon yourself, take the initiative to say, hey, like, what's everyone's pulse here? How are you feeling after seeing this and doing this? And I think nurses are really good with normalizing things that aren't normal. Like, I think that's just the way it goes. I think they call it normalization of the deviance, right? So we see something that is super untoward, something that is very strange and bizarre, and we normalize it like it's something we've seen every day. No, these things are okay to talk about in groups with your peers, to say, hey, how are you feeling today? Like, what did we see? What could we do differently? Or how could we maybe prevent this from happening again within our community? Because we don't want to see people coming in that ill, right? I mean, most of these people were very, very sick. And how can we do to, what can we do to have a more primary care model, or to prevent these types of situations that we do see, that they're so late that,
People don't often understand what you're going through who aren't in this profession. So it might be useful to, even seek out your employee assistance program and talk to someone as a professional that can really help you work through some of these feelings that you're having. And, it's okay that you're not coping if you're not coping. It's okay to not be okay. It's just recognizing that and doing something about it so that you can be your best and not let this affect you on an ongoing basis.
Yeah, absolutely. So, hey, you know what? Please feel free to reach out to us if you guys have any stories. If there's anything that you want to talk to us about, we're more than happy to take requests, and also to talk about the things that mean the most to you.
Absolutely. Thanks for listening.
Thank you.